Morning and welcome to the seminar on biometrics and the use of electronic systems in biometrics. Biometrics is a big field which involves tracking of human beings, tracking of many persons, from ordinary persons to VIPs, very important persons in the world. It is very important that biometrics is very effective because the individuals in a particular area, in a particular land, in a particular country, or in a particular region of demographics, suitable demographics or geography, are going to be protected only by this particular biometrics in the event of any disaster, or in the event of mass calamities, or even in the event of some food or water scarcity. So the biometrics is an important field which is evolving with the use of electronic systems. Without the electronic systems, biometrics is not possible, and the biometrics of fingerprint and some other early technologies are already in existence. Those are good system of rating human beings, but the biometrics advancement in terms of the retinal scanning and also the eye scanning is very important because not to protect an individual from many possible calamities, this is very important. So from ordinary persons to VIPs, this is very important for an individual or citizen of a particular region or a country. This is applicable to almost all parts of the world because of the migration, because of possible reduction in fights, and because of the individual's assessment of his or her own health and claiming the medical benefits from the certain institutions or specific institutions. So this is very important, not just for medical insurance or life insurance. Medical insurance and life insurance may be belonging to private organizations or government organizations, but it is not a good system. So proofs regarding one's identity and one's residence and one's health status is very difficult to be collected by these institutions, and they involve multiple copies or even files or xerox copies of same documents from different doctors or different authorities are demanded. So this creates a problem of maintaining so many files and so many data on a server, which is not possible 24 hours to track or to maintain the data of a particular person. So if an individual has ample number of data, so many number of data, like he has at home, he has at office desk, then it is not possible by an organization or a government organization to maintain so many data pertaining to a same individual on that desk, and it is a burden on them, and it is a nightmare when it comes to maintaining so many data regarding a particular individual. Hence, to minimize this process, electronic systems concerning with biometrics is very important because the biometrics can definitely say what type of persons are in a particular region, what type of persons are concentrated on a particular region in a nation or region in an area, so that the service from the government can be rendered appropriately. Why I want to say this, even if it is an emergency rule in a particular country, or even if it is a democracy rule in a particular country, or a sovereign rule or a republican rule, whatever might be the case, the individual has to be given a proper assessment about his own status, whether it is a socio-economic status or health development status. So health development status is very important for an individual because a person's health may be spoiled by a migrant. It may be spoiled even by a local um, poisoning, or it may be spoiled by an atmospheric emissions. It may be spoiled by high traffic. The person's health may be spoiled by even water contamination. So people do not know. When the health gets spoiled, they may not know what was the reason behind the spoilage, and also it may be even spoiled by the extensive use of some hazardous substance, or it may be even spoiled by um, going to ample number of cinemas within a month or so due to some lack of employment or due to depression. So it is very difficult to track a particular individual, um, even by a group of institutions or group of persons. And it is a hindersome job on the management to thrust or trust all these important activities. So biometrics along with electronic systems is essential. If this is compromised, then what will happen? The same person will be given so many tags. For example, if a person like me is living in this particular region of South India, if I go to some other country, then if a group of people um, identify me with some other name, then I, as an individual, migrate to some other country. If a group of people are going to see that I am an individual from South India, but my first migration to some other country identifies me with some other name and some other qualities. So the group of countries are the countries who are going to link my identity through my country of origin are going to be confused much. This puts a heavy constraint on the identity and biometrics. Why this has to be done? It is not going to be done for any big act of restricting a population or restricting a particular individual to travel across the world. It is not so, but it is going to address a particular issue called as health benefit. When a travel hardly gets any health benefit. When a person travels across the world or travels to some other country, he hardly gets any health benefits. He may be affected by a particular region, but he may not claim the health benefits in that particular region. Or the reverse may also be true. If a particular person who should not travel from a particular region to another region travels by some other means, through many other means, travel agencies, or by some visa allowances which had been lifted by some other government, travels through any other means and goes to some other nation or some other part of the world, or even goes to the doctor's cabin without proper permission. So in that case, this biometrics is very essential to scan a particular individual. So this puts a health burden on mainly doctors. We only have around 900 doctors according to statistics of WHO, World Health Organization. It says that we have 900, we have one doctor for 900 persons. We have one doctor for 900 persons in our country, which is insufficient, because this doctors count is going to take into account the Ayurvedic doctors, the allopathic doctors, homeopathic doctors, the Unani doctors, etc. So it is taking the doctors from all streams. It is not going to take the allopathic doctors only. Where the rating of doctors is very important. It is the biometrics which is going to emphasize the government or the private institution to rate the doctors, because the rating of doctors is very much important, not for just the individuals who approach the doctor, but for the doctor itself, himself or herself. A doctor cannot survive after 10 years of continuous practice in a hospital. This is well known for us because he is going to see numerous number of patients. If one doctor is going to see 900 patients within a particular time frame, say a week, he sees 900 patients, which is nothing compared to the busy doctors in the world. The busy doctors, they are going to see numerous number of patients, but on average, a doctor in a week is going to see 900 patients, for example. some patients in very critical conditions, some patients in normal condition, then the doctor is going to lose his life after 10 years. What prevents the protection to doctors in a particular society or particular region? It is the lack of biometrics combined with electronic systems. Allowing all patients to be attended by doctors is a big sin, we can say, because the protective layer of the society is always dependent upon doctors, and also allowing all persons to pass through MBBS and MD and MS. A patient cannot become a surgeon, he cannot do surgery for a person who is deceased. This is allowed because of the lack of Medicare. We have got lot many sophisticated medical hospitals and medical equipments that can protect us in the event of some emergencies, say disease emergency or even a spread of infection. And there are intensive care units and critical care units in almost all towns, all cities. But still, why this is very important? Because of two reasons I want to discuss mainly upon. Now um, you want to see eyes of a person um, is seemingly healthier. This is a healthier person. In an advertisement, you can see the eyes of the person who is very healthy. This must be the eye of an individual when he is scanned by biometrics. So, biometrics is going to continuously monitor an individual, or it is going to take the data concerning the particular individual. The eyes of a person is very important. Uh, this fact should not be ignored by the government organizations or even by the individuals. Individuals have the um, individuals have the tendency to ignore this particular development, onset of development in biometrics, because there are lot many problems that a migration group or even a traveler may create to particular biometrics. For example, as I had shown you the eyes of a better person or a healthiest person, you cannot find uh, the persons coming from some area, or a person doing labor work, a person doing some industry work or factory work, or even persons in critical high risk environment to maintain such eye. So how these persons are passed through visa criterion or passed through immigration criterion in many countries, or how these persons are accepted into our country or the region of South India, it is because we compromise on the biometrics. We think that taking the biometrics or rating the biometrics is going to harm our peace of mind, and it is going to create quarrel between the immigrants who are laborers and the persons who are in the society for a long time, which is not so. It is going to give the necessary service and caution upon the existing members of the society that those laborers have to be addressed in a proper manner. They should not be ill treated because they have got some ailments in their health. With the eyes, one can say that they have got ailments or not, and it is going to throw a lot of warning on the development of a child. A child gets infected due to older persons. A child gets infected due to mass. If a child participates in a function where mass of people are going to die, then the child may be prone to nasal infection or even fever. Only when a human being grows, he develops a concept called as immunity. The child does not have an immunity. So this is a major issue. So concerning the health emergency, this biometric and electronic systems are going to be very important. For this proper maintenance or proper development of a software system which is going to rate the human beings based on identity is also essential. how people can escape through the particular biometric within a day. I can show you. This is a particular uh, eye raising solution. If one puts a drop on the eye, then easily one can see a shining eye. If you can see, this is a drop on the eye, but how the eye is going to shine after this, I can show you. You can watch the eyes of mine. It is very clear now. The eyes of mine are very clear, and they are very bright. You can see with the use of solution. But I will also show you one another solution which is going to turn my eyes into uh, turn my eyes into that of a person who is affected in terms of his hard work or in terms of the risk. This is already I had shown you a demo of the particular chemical which was obtained from shops. If you can put the chemical close to the eye, it will not make my eyes blind. So I am bold enough to do this experiment. And this is enough to show you the demo. Now you can see my eyes. I will show you a close-up of my eyes again. So you can see the difference between the eyes. You can see some red blood vessels being protruded in the eyes. This is a simple condition because when electronic systems are not aiding biometrics properly and the biometrics is ignored, within a minute or even 5 minutes, a person who is um, having a healthy eye can be seen as a contaminated eye, or within 5 minutes, a person with a contaminated eye can be seen as a healthy person. So this is a problem with immigration check in airports and getting necessary services from the organizations in order to benefit a particular individuals. The individual is ourselves. It is not when we say individual, it is not some other person who is very unique, or he is a VIP, or he is a farmer. It is not so. Individual pertains to every single individual who has got equal right to live in the society. When we say individual, all live in the society. It is not only human beings who live in the, even cows live in the society, elephants live in the society. It is possible that human being may acquire infection from a cow, for example tuberculosis, and some diseases like jaundice, if you can see. And a human being is also prone to infections from so many living beings. For example, birds are big contaminants. They are going to cause some fever in individuals who are exposed to um, playing with birds. So these have to be taken care. How a particular government or particular health body can take care of individuals at a random manner. It is not possible that government organizations and health institutions can um, give support 24 hours to a particular individual. Individual has to go into the health organizations in order to get some benefits. This is a big constraint because if infection spreads, it will spread within an hour. It will not ask for a health organization or the government to spread. This is a problem. So biometrics is always important. The individual may not know that infection has spread. So when the biometrics is taken properly, the health institutions, health organization can assess an individual whether he needs medication or whether that particular person is free of health service, he can go happily and travel around the world with a healthy body. So this is very important for the entire region of South India, which is a peninsular India, which lacks a lot many freshwater sources. Because I live in that region, I am putting emphasis on that particular region. If I live in Canada, then I will emphasize on that particular region's biometrics. So it depends where a person lives in. So I want to throw light upon what type of systems are used in constructing such a biometric system. Now you can see the computing systems who are maintaining the uh, particular data using a software or database, how they particularly select a robust system. It is based on some model of design. If you see the software product or software system has to undergo from scratch, we cannot buy a ready-made system for this particular purpose. They have to undergo a complete development from scratch, which lays emphasis on requirements. So our requirement is our retinal scanning, eye scanning, scleral scanning, along with fingerprint has to be properly taken, and it has to be maintained by government organizations only. It cannot be given to private organization. It can be exchanged with visa embassies of different countries which are going to handle migrants. And it can be exchanged with hospitals for some benefits, health benefits. It can be exchanged with industries for main purposes of assessing risks on human individuals who are going to be exposed to risk environment. So this is unavoidable in industries. So a particular database system requires all these. Requirements have to be analyzed properly with the camcorders, cameras, and proper scanning mechanisms, and in terms of digital coding and a software which is going to process and test this particular system has to be robust. When the testing stage comes, it is very difficult to take care of many conditions based on the testing. So finally we are going to put all these systems into operation and maintenance. Where this software system fails, I am going to say you an important fact why relying on software systems makes the biometric system a failure. Because in a software glitch or a continuous supply of power to a particular system is going to be critical in determining all this. Power industry is on a burden because it has to continuously supply power to households, it has to continuously supply power to industries, it has to continuously supply power to hotels or restaurants which are dependent on customers. It has to continuously supply power to certain emergency hospital units. You have a lot many hospital units in a particular area, it has to continuously supply. But even though it neglects continuous supply of power to farmlands, so farmlands are not continuously supplied with power. We know that in news or in real practices we see that farmlands are not given supply of power. Say in a day almost 8 hours will be a power cut for them. But continuous supply as a burden for the power industry is dependent on all these industries. If we maintain the biometric systems through electronic means, then continuous power to such premises have to be done by the power industry. So this puts a burden on the power industry. And one small private organization cannot maintain this particular biometric. A government organization or the assembly has to maintain this biometric. So security now is going to be transferred to a democratic group of people who are going to reign the government for some amount of time. If they are going to be changing the powers, suppose one government comes in, another government comes in next, then again they have to maintain this particular data of citizens or individuals, which is very important. So now the additional responsibility of whoever governs, they have to maintain the data of individuals, they have to maintain the citizens data, makes them more responsible in a society. We cannot say that it makes them irresponsible in a society, and one individual may fear that this may create a problem. A country which wants to manipulate the biometrics comes and holds a particular government and steals all the data from a particular government. We may be afraid, but even though if we are afraid, for what this particular data is vital, it is for maintaining our health in the region where we live, and we are exposed to lot many hazards in our environment. We are not exposed to hazards in America. I am in South India now. I am not exposed to hazard in America, and similarly, an American in America is exposed to hazard. A Russian in Russia is exposed to hazard, or a person in Balkan state is exposed to hazard there. So for him, the biometric data corresponding to that region is important, and his individual biometric data is important. For me, the individual data here is important, and I am exposed to some risks wherever I work, wherever I travel. So this is very important for me. It should be localized and should be properly maintained by the largest organization. So we need the help of government organization for this purpose. Government organizations are largest organizations, not the private organizations. So this, along with electronic systems, will make the government more responsible rather than thinking about other challenges like bribery or other challenges like caste, religion, or population, unemployment, etc. This is very important. How government employees are made more responsible, it is in this particular manner. So use of electronic systems and biometrics data make them aware. It throws intelligence upon them rather than one criticizing them, or one criticizing a political party of some wrong manhandling, or criticizing a particular individual for wrongly channelizing, or criticizing a particular religion for attacking some other group and branding them as big terrorist groups. This particular secure data maintenance of a single individual in a government organization is going to make government more responsible, and this is what is needed from the government. I as an individual can maintain my own data. I can take the biometric scan and scan of my retina and maintain it in my personal computer, or maintain it in my mobile. I can use even advanced camera to scan my retina, and I can even say within a week what changes had taken place in my eyes when I travel around the world, or when I travel around the area in my region. This is possible, but it is not going to help the governance. It is not going to help the doctors in the hospital, or doctors even cannot help us in case of emergencies. Why they cannot help us? Because they lack the history of our health. The history of our health is very important for doctors. Whether you concern about the government, whether you concern the religion, caste, or whether we are concerning the type of government, democracy, bureaucracy, communism, etc. All these are only after health of an individual. When health of an individual is spoiled, we will only see so many mad persons who are going to be part of all these industries, all these governments, or all these communities. We can only find diseased and mad persons when we neglect all these use of electronic systems and biometrics. So this is very important that as individual we protect ourselves first, then we speak about the community, and we will speak of the development. So what can aid to the development? the electronic industry cannot aid to the development of developing an infrastructure. So infrastructure is done by builders. Electronics industry cannot help the development of farming. So what we consume, it is not going to help. So our health is going to be dependent on this infrastructure, not electronic system, but our health tracking is going to be dependent on the biometric systems. And health tracking is very essential for a person to live peacefully. So how these particular the concept of waterfall model of a concept of software system is a failure in case of biometric, I have shown you, because it is going to finally it is going to address the operation and maintenance, which is going to take into account lot many conditions or lot many challenges from the power industry, from the maintenance, from the employment needs, it is going to take in. Now I am going to show you a slight modification in the same software development, which is going to avoid these sorts of problem by a quality management. So you can see now this is a particular system. You can see we have a proper rent accounting management system, then it links to the database of the government, then it puts the allocation and tracking. The allocation means it is not the allocation or of accommodation to an individual, it is tracking of persons. A person is living in this rented house, so it is not possible for the government to build one house for every particular individual in the country, or even every particular individual in the state, even if he is a VIP or if he is a doctor or if he is a employee of a big organization, it is not possible. So it is dependent on a lot of problems. So allocation is the particular person is going to be tracked, that he is going to be living in this particular region in a rented house. Then if he migrates his rented house, the same database is refreshed. So this has to be properly maintained. It is not properly maintained due to biometric reasons only. Now we have the database server. Database server is the largest server which is going to process the database. You can take the Indian Railway System IRCTC database, which is going to take in reservation requests of a particular individual. It is going to give us seats in train. When it is possible, then this is also possible. Now we can see the voids management. That means where we are going to waste our resources, the voids management is very important for addressing that particular issue. So for this we have the maintenance systems and the interface systems, housing benefit and other systems. This housing benefit is going to be the lawmakers freedom and the democracy freedom is going to be seen in the housing benefit, not in these database servers or allocation or rent accounting management system. So rent accounting management systems are going to be part of secure servers of our country or the region where we living, but the housing benefits can have freedom in democracy. Say a VIP belonging to particular party can be allocated a house. So housing benefit depends on the freedom of democracy. So here they can exercise their right, and even judiciary can exercise their right. Judicial magistrates can be allocated house, and even collectors can be allocated house. But those houses are going to be specific only for the regime. After they retire or after they are getting transferred, that particular house is going to be allocated to some other person. Hence this particular rent accounting management cannot be a static database. It has to be a dynamic database which has to track the history along with the biometric of the individual. So biometric of the individual is very important. When we have electronic systems combined with biometric systems, the hazards are multiple data for a same persons to be maintained is going to be minimized, and multiple data for a person's health status in hospitals, in scanning centers, in radiology centers, or in drug administration, vaccine administration by the government, or the government borrowing from the World Bank or borrowing from World Health Organization or government contracts with high cost medicines can be minimized. So how as an individual I am very responsible in rating all these things. As an individual I can be very free. I need not bother about any news in the newspapers, any news in the television. I can be free that ample freedom is given to me. I need not bother even about anything in the society. I can say that the society is free of diseases, society is free from communicable diseases. The persons whom I am chatting with or I am playing with or I am going to converse with are free from any communicable disease. I need not have any hesitation in talking to people, talking to masses, talking to communities, or I need not have a fear that there may be a theft in my house, there may be a robbery which is going to take place in this particular area. I need not have fear. It is only disease or the ailment or the inability of a particular person or a group of persons in a community which make them commit crimes. So increasing number of criminals day by day are due to diseases only. If we can minimize this or if we can give a best solution to isolate such criminals or diseased persons or even healthy persons ragging diseased persons, healthy persons quarreling about criminals, healthy persons dragging the diseased persons into argument and making them ashamed of themselves. All these can be avoided by proper maintenance of biometric systems. So biometric systems lessen the talk between the individuals and lessen the clash between individuals, lessen the clash between the citizen of a nation and the government. It lessens the clash between communities based on some grounds. So biometric systems are going to be very important in also claiming the health benefits from critical organizations. So we need to lay emphasis upon this maintenance of the systems. And in many regimes, whether it is going to be a communist regime or republican regime or whatever regime it may be, the advancement of this biometric data is being neglected because we think that only if we treat ourselves as submissive or inferior to others, then we think that they may help us. This is what is being manipulated by employers in rating themselves as very poor compared to government organizations, and they ignore the fact that this is a compromise on our security, individual security I am saying. Now as I have spoken about individual, I want to address the individual. Here user is an individual. I am a user, I am an individual. User is going to see the degree of user satisfaction. How he can see the degree of user satisfaction? When his particular history of health is going to be properly maintained, where he is going to get serviced, then he will be satisfied. This is called as a quality. Now this quality is dependent on the product. So what type of product he looks upon, that cannot be decided by the individual himself. That's why he needs the help of government organization and advanced technological institutes which are going to act upon it. Then the product has to be conforming to standard. Standard is very important because it has to be compatible with the WHO, World Health Organization. World Health Organization has got ample number of data in them, and they are one organization which are raising their voice every now and then against a lot many issues which are concerning health of individuals, not about all politics or even needs of an individual. Health about individual is very important because the individual as a human being has to protect himself not just from human beings who are contaminated. We are always seeing that human beings get contaminated and it is permanent for them. It is not so. A communicable disease can be even cured when there is a proper health system, and we need to protect ourselves from calamities like disasters, flood situations, and we need to protect ourselves from traveling ailments. We need to protect ourselves from aging. Human being grows in age, and we need to protect ourselves from industries which are giving their exhaust. We need to protect ourselves from high traffic zones, which is causing pollution. Then we need to protect ourselves from dust storms. Then we need to also protect ourselves from mercury contamination. We need to protect ourselves from the poisons which are found in the land, and we cannot help for that. We need to protect ourselves from our own wastes. We need to isolate our own wastes. We put garbages, we throw our waste materials, and we need to protect ourselves from those. And it is a very we need to protect also from some animals which are found. Animals are found in abundance in our regions. We are thinking that only human population is huge, which is not so. Living beings and animal population is huge than human population, so we need to protect ourselves from those animals, because they are not um, intelligent enough to manage their health. If we take an animal is not intelligent enough to manage its own health. We can find unique intelligent animals in such cases also, but we are not going to see the minority in such cases. We have to concentrate upon the majority rather than the minority. Majority is very important in region, and we have to protect ourselves being a majority. And if majority are contaminated, still we have to protect ourselves from them as individuals. So I as an individual has to protect myself. How I can protect myself? I have to rely on best service which is amicable and affordable by me. I cannot go to a service which is going to cost me around 5 lakhs or 10 lakhs on later stage of my life. I have to arrest this particular cost, and I have to put a constraint on myself, saying that the expense for maintaining my health is going to be reduced in future, because I am going to see a proper measure called as in aging. As a person grows in age, then he cannot expect the same immunity which he can have at the age of 90 or 80. It is very difficult. So age is very important. So in the 30s or 20s, we can say that we are very robust and we are highly immune to all contagious diseases, but it cannot continue if one person grows in age. So all schemes are almost only secondary. They have not addressed all these factors properly from the development. So a best development has got the particular layout which I am showing. You can see the product quality, which has got the internal spec and external spec. External spec is from World Health Organization. Internal spec is from the local area, that is the local region where I am living. You can see the design quality which is based on external spec, but the product quality which is going to be based on internal spec. Then we have the software which is going to maintain our data, biometric data, the retinal scanning, scleral scanning, and also our identity, that is fingerprints, which is going to be maintained by the software. The software has got a spec. We cannot design a software as and when we like. I can also maintain the data in an Excel sheet. That is enough for me, but it is not going to throw light upon the service and benefits which I have to get from the government or specific body or industrial organization which I am going to work on. So when we neglect all these particular electronic advantages, electronic systems which are going to aid the biometric system of implementation of such a good service to the individual, then all institutions will employ the individuals as cheap labor. That means inexpensive labor will be deployed. Even criminals from neighboring island or neighboring jail can be deployed in a particular industry, and the industry can survive with the criminals without giving them even proper amenities, because they are criminals. They know that industries can treat them in any way. So in this manner also, an individual or a citizen in a particular society gets affected. So we need to be very alert in arresting such exploitation of human beings by human beings, and human beings even by animals. We cannot say that human being is a exploiter of another human being. Even animals, wastes, pollution, even calamities are exploiters of human beings. So individual has to be concentrated upon, individual has to be addressed first, then comes all the other groupist activities which are going to create problems in the society. So this particular biometric systems and the individual service addressing system is going to benefit the individual much. If you take the software spec, it is going to conform to the standards, only then it is going to be developed as a software product, and the user needs are automatic now. Biometric systems are in place exactly, and user needs are automatic. Why this is very important in a most populated region rather than a sparsely populated region. If you take a sparsely populated region, hardly people travel to the region and they are bothered about that particular region. For example, in nature land or a wonderland, visitors to such a particular region are only seasonal. They are enjoying that particular land and they are leaving the land, and nature has got its own way of disposal. People working in particular land are very minimum, but if you take a most popular region, populated region, then such a region involves all these systems to be deployed immediately in order to avoid health deterioration and health degradation. So we need to see that the quality management system is going to be very effective for us. Along with the biometric system, we are going to see in future. We cannot say that biometric systems are in practice and they are very correct, because here the politics of community, politics of religion, politics of developed and developing countries of the world, and politics of well developed regions, obedient people in the world, all comes into picture. So this puts a condition that only obedient persons will be given some allowances, other persons will not be given any allowances, their data will not be recorded in the system. This is what any management can say, but this is may lead to failure, because even obedient persons may get affected due to some health degraded persons. This is a big problem concerning a particular society. So biometric systems in congregation with electronic systems, congregation with close um, server data management along with the WHO, World Health Organization, is a must. And where this biometric system and electronic systems are very vital, where people live in large quantities, where population is more. So for this reason, one who does not want this particular system or biometric system or electronic system can isolate himself and live in forest. It is not possible by a human being. In those days where people lived in forests, or people lived lonely, how they lived, I can show you one small photograph of the ancestor. You can see this for these type of persons are ancestors of our living community, but they lived in an isolated place in their region. They used to protect their head, and they used to protect themselves out of all animals. They used to live away from animals. They used to live away from fields. They used to live in only protected areas. That's how they protected themselves. But it is not so. An individual in the present society is not equal to the ancestor of the society. Ancestors of the society were very proper in even protecting their head. But nowadays we are seeing our dress as modified. We are free. We think that our not wearing any gadgets or any protective clothing on the head, for example, cap or even clothes on the head, or wearing glasses, wearing proper cuffs, wearing proper clothes, still we can survive. We are in that mode now. So, if we are in such a mood and such a modern world, then we need to concentrate upon the biometric system. It is very important that a biometric system has to be in place in order to even arrest movement of persons across two industries. For example, one is the educational industry, another is a film industry. So persons working in film industry cannot move closely with educational industry for lots of reasons, because the film industry and educational industries are separately handling people. For examples, people with a lot of communicable diseases are handled by certain industry. I don't want to name which industry handles. So biometric systems are an important and integral part of any modern world. If we think about the ancestry and traditional world, we need not bother about anything. But we are in the modern world. We have to succumb to the needs of the modern world. And I, as an individual in modern world, um, I want um, that the biometric system is in progress and it is in process and it is active forever in future. Thank you very much.